Hi, my name is Mr Nakhla. I'm an orthopedic consultant, and I'm going to tell you now about the risks and benefits of having a total hip replacement. We're doing a total hip replacement to relieve pain and improve mobility, but there are risks like any operation. Number one is infection. We do it in a clean theatre, give you antibiotics, do everything we can to avoid it. Bleeding, you might bleed and you might need a blood transfusion during or after surgery, but it's very unlikely, and I don't recall the last patient of mine needing a blood transfusion. Blood clots in the leg, not a big problem in the leg, problem if they go to the lung, which can be even fatal, but we'll give you stockings, injections, and get you up and running as soon as possible to avoid them. And in my view, getting you up and running is the most important thing to avoid them. The hip can pop out of place, which is about 2% risk, but if I do a good job and you follow our instructions, hopefully that should not happen. Whenever you bend after surgery, I want you to go between your knees with the knees pointing outwards. I don't want you to bend over your knee, because that's the dangerous position when it can get out of joint. I'll try to get your legs equal length, but it might end up being longer or shorter than the other side. There are lots of nerves and vessels around the hip joint which are at risk of injury. I'll be very careful to avoid injuring them. You might wear it out and you might need revision surgery in the future, but hopefully not. The bone can break around any joint replacement. If this happens, I'll fix it for you. So I look forward to doing your hip replacement and getting you back to your full activities within the shortest time possible.